Hi guys, welcome to another red flags video. Today we're going to be talking about a subject which is actually close to my heart, which is cancer. I'm a doctor with an interest in cancer and I'm currently working in the acute cancer and well bay where I deal with cancer emergencies. So cancer is a very emotive word and most of us will have known somebody who's either suffering from cancer or who's died from cancer, and it's something that we can often get quite worked up about and worried about in ourselves. But when is a symptom that you're experiencing what we call relatively benign and innocuous and something that we maybe just need to keep an eye on? Or when is it more of an urgent symptom that needs us to go for medical help straight away? Now, cancer is a very, very vast subject, so I'm not going to spend too long on this video, but then I'm actually going to break down the various forms of cancer and talk about them in detail. So, one of the red flags of cancer, which I think everybody knows about, is what is known as unintended weight loss. So unintended weight loss means that obviously some weight loss can be intentional, particularly at this time of the year when most of us are on diets. But if it's unintentional weight loss, it means that you weren't expected to lose any weight and then suddenly you're shedding kilograms of weight and you don't know where it's gone. Particularly if you notice that maybe you've gone down a notch on your belt or your pants are a bit looser, and particularly if people start commenting that you have lost weight, then that can be a little bit of a red flag. And it is important that you do weigh yourself and see roughly how many kilograms or even sometimes stones you've lost. So cancer in itself is a very metabolically active process, which basically means that the new tumour that's growing somewhere requires a lot of energy and requires a lot of growth factors. And often in itself, cancer can be quite metabolically active, which is a reason that people lose weight, because you need to divert extra resources, extra blood, extra kind of glucose to the growing cancer in order to nurture it. Which in itself sounds quite horrible because it's something that you don't particularly want in your body. But once it's implanted itself and once it begins to multiply, it is metabolically active. So it does require those extra sort of energy growth factors, glucose, which is the reason why people tend to lose weight. So that's one of the big red flags of cancer. Another thing is in itself something called anemia. So many of us may have experienced anemia, and that can be something that's relatively benign. So there's various different types of anemia, which I'm not going to go into, but sometimes it can be caused by a deficiency, such as a B12 deficiency, a folate deficiency, a dietary iron deficiency if you're a vegetarian. But in cancer, you actually experience something called iron deficiency anemia, which means that you're losing blood from somewhere. So this could be that you're vomiting up the blood. It could be that you're losing it from the other end and you're pooing out the blood and you notice your straws are a bit darker. Sometimes you don't notice it at all, but you're maybe bleeding somewhere in the body, and often this can be at the cancer site itself. So iron deficiency anemia is a red flag. The only time you will probably notice it, or your loved ones, is when you're looking paler than usual. So if you're looking very pale, particularly when you pull one of your eyelids down and it doesn't look all pink and red and quite kind of sort of like the blood's getting to it, that in itself can be a red flag. But this is when you start putting all the signs together. So tiredness, extreme tiredness, anemia, weight loss, these are all kind of red flag symptoms, or at least symptoms in their isolation might not be so bad, but ones that you together need to get checked out. Lumps and bumps anywhere in the body are sometimes sinister, but not always. So there are perfectly innocuous lumps and bumps in the body that aren't sinister. For example, you can get fatty tissue deposits called lipoma, which if they're mobile under the skin don't mean anything. It's just a simple day case surgery removal job. But often lumps in organs can be quite ominous. For example, women, if they've noticed a breast lump which is quite round, discreet, nodular, maybe tethered to the skin, maybe some sort of breast changes on top of it, then that can be a bit of a red flag. Gentlemen, if for example in the testicular area, if they notice a particularly painless lump. So sometimes you can get lumps in the testicles, for example, which are quite painful and they're quite inflamed. And this can be a sign of something, for example, called epididymolycitis, which is an infection in the testicles, which you actually need antibiotics for. So in itself is not sinister. If you get any lumps in the neck, they could be associated with the thyroid. But again, there's lots of reasons why you can get lumps in the neck. For example, you could have a goiter, you could have problems with your thyroid gland. It could be underactive, it could be overactive. So it's not always something to panic about, but it's just to make you aware that this is something that you need to go to your GP and get checked out. 9 times out of 10, there'll be a perfectly common reason for that lump or that bump, and it's something that you need to monitor. So I think monitoring is quite important, but it's also important not to leave things for too long. So if you're noticing that symptoms are progressing, if you're noticing that your tiredness is progressing, if you're noticing that your paleness is progressing, if you're noticing that you're not managing to put on the weight that you've lost, if you notice that that lump and bump is still there for quite a long time. So they're sort of the overall signs. Cancer in itself, a lot of people think is due to pain, but it's not often the case. For example, people can have a brain tumour for many, like 1 or 2 years that's growing, and there might not be any pain at all. And it's only when the cancer often invades into the invading structures, when it's quite big, that people start experiencing pain. So a lot of people think that if they're pain-free, they're healthy, but that's not always the case, because things like brain tumours, testicular tumours, stomach cancers, pancreatic cancers are the silent killers that everybody talks about, which are completely pain-free, and it's something that we also associate with what is known as a painless jaundice. So jaundice can be another symptom, but it can also be something associated with gallstones, for example, which aren't a medical emergency, but we do need to do something about them. But a yellowing off the skin, it's only when it's a painless jaundice. So a painless jaundice means that everything is honky-dory, and gallstones are often painful. So if you've got a gallstone, then you'll have a bit of pain in your upper tummy, and as your bile tries to, as your gallbladder tries to contract against the stone, that causes what's known as a colicky pain. So that's why if you're having a painless jaundice, that can sometimes be sinister. I'm going to be making the next few red flag videos talking about the different types of cancer. So I'm going to be talking about the common cancers. I'm going to be talking about breast cancer in women. I'm going to be talking about lung cancer in men, risk factors and sort of some of the symptoms, how you deal with it, when it's advisable, some of the red flags when you need to go to a doctor. I'm going to be talking about prostate cancer as well, and I'm going to be talking potentially about 1 or 2 other types of cancers. So that will be what my next few videos will be about. I think brain cancer is a particularly interesting one as well. Great, so thank you very much for tuning in. If you've got any questions about any types of cancers, or if there's anything that you would like to contribute in terms of your comments, then please do. I'd love to see and hear some of your comments, and I'd love you to subscribe to my YouTube channel, and that will encourage me to keep making more videos. All right then, take care guys, bye.